Good afternoon, everyone, and welcome to this afternoon's press conference. You are live on YouTube, and the date is the 22nd of January. Hope you're all well, and thank you for joining us as always. Today, we will have our panel of speakers will be Lucy Whiteman, Eileen Doyle, Superintendent Elliot Foskett, and Toby Sanders. And we're also joined by a number of representatives from our councillors, including the leaders of Tom Beattie, the leader of Corby, Martin Griffiths, the leader of Wellingborough, and Jonathan Nunn, the leader of Northampton Borough Council, amongst other people who can also answer any specific questions. So the running order will be Lucy, then Eileen, then Elliot, and then Toby Sanders, and then we'll open up to the written questions that we've had submitted kindly beforehand. So if everyone could please mute on entry, that would be great. And if we have time for further questions at the end, then if you could put your little blue hands up, and I will try and come to you if we haven't run out of time. Thank you very much for coming today. I'm going to go straight to Lucy Whiteman, our Director of Public Health, to give us some key figures from this week. Lucy.
Thank you, Councillor Morris, and welcome, and thank you, as Councillor Morris says, for attending and for your continued support with everything. We've got some slides for you. As always, we've got the latest surveillance report. I'm conscious of the fact that we've got quite a lot of questions and quite a lot to talk about because lots has happened this week. So I am going to go through this quite quickly, if that's okay. Obviously, it's on the council website and available for everybody to see if they want further detail. But key headlines, if we start with those. So clearly national lockdown restrictions continue to be in place.
I love you.
Continues to be in tier 4. And part of the challenge at the moment is the fact that we've got this mutant virus strain that is obviously much more transmissible, up to 70%. So, and it's causing our numbers along with other areas to significantly increase. Therefore, people who are clinically vulnerable previously in the first lockdown are being advised to shield again. Again, there is advice and support available through the Northamptonshire County Council website, should people need support to do so. At the moment, we're at a point where in the last 7 days, up to the 17th of January, we have had 3,643 cases of COVID-19 in Northamptonshire. And despite national lockdown rules, we are still seeing that household mixing is the main cause, either cases mixing with other household members or indeed households mixing with other households. So again, it's a call to action for people to adhere to the rules. The sooner we are compliant, the faster our case rates come down, and the closer we will be to coming out of lockdown. And again, just because of the sheer numbers, we are still very much feeling that pressure in hospital admissions and sadly deaths around COVID-19. And indeed, that pressure is very much felt in our adult social care providers, who have done a sterling job and continue to work really hard to keep our residents as safe as possible, and also in primary care. So please obviously do bear that in mind. Our services are under continued pressure. So if we jump first to the first page of data, it just gives you a bit of an idea about where we are with regards to our case rate as compared to previous weeks. So yes, it is a reduction, and that absolutely is good news. And it demonstrates the fact that everybody's adhering to the rules. Those that are is absolutely having an impact. I think it's really important to reinforce the fact that this is working, but we've got to keep doing more of the same. People can see we're still a very long way from being back to even pre-Christmas rates, let alone the type of rates that we saw in the summer, which is where we obviously had those freedoms extended back to us. So absolutely starting to see a chink of light here. Let's keep doing more of the same, please. If we move forward. So this is the crude numbers. Again, a good news story. We've got decreases in as much as there are fewer number of cases in each area. In some areas that is literally a handful, but the good news is it is starting to look like we are on a downward trend, and we've got to keep working hard to make sure that that is maintained. If we skip down to the rates. So again, people can see now we have got Northamptonshire as similar to the England rate, which is really good news. We have still got two areas that continue to be stubbornly high. Corby and Northampton, as you can see here, statistically significantly higher rates per 100,000 population as compared to both the county average, but also the national average. So clearly some more work to do in our more densely populated areas. And again, we've got to make sure that community leaders, parents, advocates are making sure that people understand the messaging and are doing what they need to do to get us back to where we want to be. So if we move down, just have a quick look, this is our deaths. So, clearly those that are affected are still being significantly impacted. And this is an increase on the previous week's number of deaths, very sadly. So an increase in nearly all areas, only a small decrease in East Northampton, Wellingborough. So again, there are 70 further families who are mourning the loss of somebody due to this terrible vaccine, virus, which is, broadly preventable. I think that's the biggest part of the tragedy, is the fact that if people were doing the right things, if we were able to get people to be adhering to the rules, we'd be reducing the risk and we'd be, losing fewer people and loved ones in Northamptonshire. If we go and have a look at the age groups that are currently affected, if we skip down, we've still got that large bulk in the younger age group. Now, we do recognise that this is due to quite a lot of younger people being employed in professions that perhaps they can't necessarily work from home in, but I do still feel that there is genuinely an issue with compliance in younger age groups, and we have got to be conscientious and take personal responsibility for our actions and recognise that, yes, that age group is less likely to be very unwell by having COVID, but we are seeing an increase in admissions in our younger age groups. Indeed, we're seeing some deaths in our younger age groups. And fundamentally, those people are posing a risk to others. That is unacceptable and it is actually illegal. We need to be making sure we are adhering to the rules. If we just quickly jump down to the next slide. And this is the part of the problem. We've still got transmission into our older age group, and this is still making up the bulk of our admissions and indeed our deaths. We are seeing good news. You can see, a really good drop in the Corby rate there in the over 60s and a slow decline in the over 60s in Northamptonshire, but it's still not rapid enough, and the pressure is still being very much felt in our acute setting and adult social care settings. If we skip down, so I'm going to make this brief, to our outbreaks, if that's possible. And part of the challenge here as well is because this is so much more transmissible, this strain, and we have got people still obviously socialising, moving around, attending workplaces, we are seeing an increase in our outbreaks. In fact, we've now got 9 in workplaces, but we've seen a real spike in the number of outbreaks in care homes and care services. Now, those aren't just care homes, that is domiciliary care as well, so people who go into people's homes. It's really challenging, and we do need to make sure that where people have got to provide those services, and they're absolutely essential, that we reduce all of the risk as far as is possible elsewhere. So please, we've all got to join together and support, particularly adult social care services at the moment. They're working really hard to make sure that they're able to maintain services in what you can obviously see is quite challenging circumstances. The one thing I do want to mention, obviously, is the fact that, one of the ways that we're able to identify COVID and get people to isolate is through our normal PCR testing. But as people will know, that's only been available to those who have been, symptomatic to date. The really good news story is that as of this week, we've got 2 asymptomatic community testing sites up and running, one in Corby, one in Northampton. And by mid-February, we're hoping to have at least 1 community testing site for people without symptoms in all of the boroughs and districts. Now, due to the capacity that we're able to manage to get through those sites, in the first instance, we are focusing all of our efforts on those people who do have to work. So key workers coming in and getting a rapid test result within 30 minutes so that they know whether they are contagious at that point in time. Really, really key to reducing these outbreaks as we go forward, but also means that those who can't work from home have got some form of security around the risk that they may be at, but also the risk that they may pose to other people. So exciting news, a big step forward, obviously another one of our tools in the toolbox, but everybody has still got to maintain that hands, face, space mantra, and not just in the way that they talk about it, but also in their actions. So I'll stop there and hand over because I know there's a lot more news to share this week.
Thank you very much, Lucy, as always. Some encouragement in the figures, but no reason to sit back and think that we're out of this by any stretch of the imagination. And there'll be some weeks, if not months, potentially, of keeping this going, and we must all keep doing that. Thank you so much, Lucy. I'm going to bring in Eileen Doyle now, who's the Chief Executive Officer at Kettering General Hospital, to give us an update of what no doubt is a fairly stressful and worrying situation at times at the hospitals. Thank you, Eileen.
Thanks, Councillor Morrison, and hello everybody this afternoon. So just an update really from both Kettering and Northampton General Hospitals. We remain very busy and that busyness does not seem to be abating. So today we have just under 400 patients in our beds today with COVID. And that's almost, to put it into context, just under twice the amount that we had in our first wave. So really encouraging news, as Lucy said, but we are by no means out of the woods. And we are expecting this level of demand to continue for quite some time, because of course there's a lag period often with people who really demonstrate symptoms that need to bring them to hospital. So also alongside that, we have 26 patients between our two facilities that are receiving the highest level of care in intensive care. And that is about half, again, that's half the number of beds that we've got open, because don't forget, people come into hospital intensive care units for other reasons. So 26 patients with COVID related issues, and then we have about the same number with non-COVID related. So really, really busy for the two units, and the staff are working tremendously hard. And I know each evening when we turn the TV on, there are lots of reports nationally and lots of access now into intensive care units. Ours looks exactly the same. And our staff are under exactly the same pressure. So we really do need to keep up our vigilance on how we contain what's going on and protect ourselves from getting sick. That said, we are continuing to treat as many patients as we possibly can. We are continuing with our urgent and cancer treatments for patients. So we didn't want to stop those, and you'll have heard me talk quite a lot before about trying to bring in all of those patients and all of those people that need intervention from ourselves. So we continue with that, but it is an uphill struggle, because the more patients we have with COVID in the hospital, the less beds we have available for other things. And so it is a delicate balance, and you will know because it will have been in a number of your outlets over the weekend, that we took the decision to Kettering to move paediatric services around. And we have moved them into a smaller facility on site, into a different ward, and that's allowed us to bring more adult beds online, and also distribute oxygen around throughout that ward, which is a really important feature. So we have done some internal moves. It was planning ahead, because we go very much on what the data tells us, and of course the data changes, but the thing we never want to be is caught out and then on the back foot. So that was a preemptive move, and I'm massively grateful to my paediatric colleagues for doing that so swiftly. And I think that we are managing, both organisations are managing, but sickness amongst our staff is quite high. So today we have 827 of our 10,000 staff off, and about half of that number are off for COVID or COVID related difficulties. And so, we are not immune. The more community disease there is out there, we live in the community, the more likely we are ourselves to unfortunately contract this virus. So staffing is a struggle. Everybody is keeping their chin up and digging deep, because this has been going on a long time. And I, like all of us on this call, want to come out of lockdown as soon as is feasibly possible, but what none of us want to see is another wave. And so it's really important that we keep on top of that. I know that one of the questions that's been coming up a lot and has been asked recently is, what do we do around ladies that are just about to deliver their babies? And it's an exciting but scary time. I think having a baby and having a baby when you're in the middle of a COVID outbreak is also perhaps there's a level of anxiety there that perhaps in ordinary times wouldn't be there. So just to reiterate and make sure that everybody knows that both hospitals do allow a birthing partner in with the lady who's having the baby. We say it's one birthing partner. We do ask, nevertheless, that if the birthing partner, and in fact also if unfortunately women who are pregnant can also have COVID at just the wrong time, that we make sure that we deal with ladies who are having babies, and we try and treat them preemptively if indeed they are unwell prior to them giving birth. We do test mums to be and also birthing partners, so that we are being as careful as we possibly can, but we do ask that birthing partners in particular do not come onto site if they're symptomatic, or isolating where at all possible. If there is a lady who is about to give birth who has some particular vulnerabilities or needs, we will assess that on an individual basis. So for example, if somebody has a learning disability or they have particular mental health issues or anxiety, we will work individually with that lady to make sure that she feels safe and cared for. We are sticking to the Royal College of Obstetrics guidelines at every step of the way to make sure we're being as accommodating as we possibly can, but bearing in mind also that you know, we don't have all the room in the world, and so therefore footfall onto the hospital sites is a big consideration of ours, which is largely speaking why we've taken some of these steps. But we will schedule appointments and scans and so forth at the best possible time to make sure that we're not overly congested. So I think in summary, the only other thing I wanted to say, with vaccines rolling out, which is brilliant, I mean, we can all see light at the end of the tunnel now. I suppose the message from us in the hospital is please don't become complacent. Just because you've had your vaccine or you've had COVID does not make you invincible, doesn't necessarily make you immune. And please don't feel the need to go out and party or do whatever it is you'd rather be doing, because until we are all out of this, I think we have to stick to the guidelines, stick to the rules, and that way we hopefully will all see brighter times in the summer. So thanks very much.
Thank you, Eileen, as always, for your insightful news on what's going on in the hospitals. And as always, we really do admire the work that's going on in all the hospitals. But as Lucy said, also amongst all our frontline workers, including the social care teams, the adult social care team, the schools teams, it really is a massive team effort across the piece, and every part of that jigsaw plays its part and is testament to the fact that we are responding very well to this virus in the county, and so I send my thanks and everyone else's to all those key workers. Thank you, Eileen. And part of this, of course, is about enforcement, and we also have an amazing police force that are doing great work for us in helping to enforce the rules. It's not everybody, but it is some people that are still not following the guidance. So I will most people in the county, of course, are obeying the rules. That's it's a small number of people who don't. So I'm going to come over to Elliot Foskett, Superintendent Elliot Foskett, to give us an update on enforcement and other things that the police have been up to this week. Elliot.
Thank you, Councillor Morrison. Good afternoon, everybody. I think I'll lead off by just saying, you know, this does hit home fairly often for us. And there's a PC Warren, Metropolitan Police officer who sadly lost his life today, aged 37. So our thoughts from Northamptonshire Police are with our colleagues down in the Metropolitan Police and his family. So just a few updates for you. This week, we piloted something here in Northamptonshire Police, which is unique across the country. We've not found any other forces doing this yet, which is the lateral flow testing and mass testing of our colleagues here, supported by our public health colleagues. We have brilliant support from them, enabling us to train our staff to do lateral flow testing. We did a pilot with that this week, and great news for us. We managed to get through quite a lot of people, about near enough 100 people in over the space of about 8 hours, really, and we didn't have any positive tests from that, which is great. It's good reassurance for our staff and good reassurance for the public that we're able to maintain our resilience as well. So we're pleased with that. And I just want to lead on from what Lucy has just said. Really, you know, it's really good news. The figures are really good news, but it's not licensed to change behaviours. It doesn't mean you can take your foot off the gas. You know, I have to say we're still seeing a reduction in the average traffic flow on the roads of about 30%, but that's still higher than we saw even at the start of this lockdown, as people are starting to use the roads. So again, I know I said it last week, please really consider whether that is an essential journey that you're undertaking, and don't run the risk of getting stopped by my officers and having to account for your journey, which may not be necessary. Our calls and online notifications from the public around COVID breaches are high. We've seen quite an increase in the amount of calls we've got for people reporting breaches from neighbours and from other people. And I think it comes back to what I said last week, really. The tolerance levels of people now are much lower. People are unhappy that they are continually seeing the small minority of people continue to breach. And I think we can't police our way out of this. I know I've said that before. It's not a policing crisis. It's a health issue, but we are there to support our partners, and people altering their behaviour and sticking with the rules and the regulations is key to reducing this spread. We've seen those figures that Lucy introduced earlier. It really is starting to turn a corner, but that doesn't mean we can be complacent. We have to obey the law, have to obey the rules. So I've said it before and I've said it again, if you act irresponsibly, then you can expect us to enforce the law. I mean, a similar risk really to deciding to drink and drive. It's reckless, it's irresponsible, and it endangers not only your life, but the life of other people. Public opinion is pretty much the same on both. You are endangering people's lives if you decide to act irresponsibly. Don't do it. There's only a small minority of people do, and I'm telling you, please don't do it. This week, we saw the Home Secretary's announcement, Priti Patel, around the increase in the level of fines for those who decide to attend a party. £800 is a lot of money, and my officers won't shy away from issuing those fines, as we've done with others as well. We will continue to enforce it. We haven't seen the legislation around that yet, so we can't really comment on the intricacies of it and what that actually means and the scope of it. But we have issued tickets to people at parties before when they were £200 for breaching. And as you know, for those people who decided to organise a gathering, we've issued 14 £10,000 fines since that legislation came in, which is a lot of money. So to give you a scope of the kind of things that we deal with around that, I think from the 1st of December to date, we've had around 537 reports of parties, large gatherings, unlicensed music events. And you can see in a small county our size, if you magnify that across the country, you can start to see the scope of the problem and why the government is introducing this legislation. We've managed to get to around or over 70% of those incidents as well. So we've taken quite a lot of action. And I know one of the questions was, what's our comment on it? And I would just say that, as a service, as a police force locally, we welcome any measures which really help deter people from acting irresponsibly. Attending a party or gathering is clearly going to cost you money if we come around. So if you choose to have a party, if you choose to attend a party, then you can also expect some uninvited guests, because we will be coming to see you. So finally then, just a little update on where the rest of the enforcement is across the county. I think, as Councillor Morris said, the vast majority of people are complying. We have seen a lot of compliance generally with officers out and about, but we do enforce robustly where we find it, and we've been doing that for the past few months. And I give you the comparison. Last weekend, Northamptonshire Police issued 113 fixed penalty notices. So to put that into context, the Metropolitan Police issued 140. They're 10 times our size. You can see we are doing our bit locally to support our public health partners. So that's it from me. I know there's a few questions later on, but I think that's it for my bit of the introduction.
Thank you very much, Elliot. And it really is heartening to hear that we are enforcing so heavily. I think it is really important. And I know you would say it, but the fine of 800 doesn't mean you have only 15 people or more and you get fined. You're still fined if there's less than 15. It's just a slightly smaller fine, but it still applies. So don't meet up, don't have parties. I mean, it's pretty clear, isn't it? So thank you for that, Elliot. And both Lucy and Eileen have referred to sort of the light at the end of the tunnel regarding the vaccine. And so I would like to bring in Toby Sanders from the Northamptonshire Clinical Commissioning Group to give us some information on how we're doing with the vaccination, which, as I understand it, is going extremely well. Over to you, Toby.
Thank you, Councillor Morris, and good afternoon, everyone. Before just turning to the vaccination programme, I just wanted again personally to emphasise those messages from Lucy, Eileen and Elliot. We're in a really pivotal moment, aren't we, in this pandemic across the county and the country. We've got two realities going on at the same time. We've got the reality and the need to continue to stick with all of the guidance and all the rules, hands, face, space, and the lockdown rules. precisely because of the pressures that we know that Eileen has described. And I just wanted to say my deep personal thanks, Eileen, to all of your staff in the 2 hospitals, as well as our care and social care workers across the county, our primary care colleagues, because everyone is working so hard to protect and look after and care for the residents of our county. At the same time, we have this moment of hope in terms of the rollout of the vaccination programme, but we have to be so careful not to become complacent in this, as Eileen was saying a moment or 2 ago, because there is a real risk in this pivotal moment that we could actually lose some of the ground that we've made, and we need everyone to carry on doing the things that we've been doing so well in order to buy us time and space to be able to complete this rollout. On that note, though, I am really pleased today to be able to kind of announce significant further progress in the efforts that we've been making across the county here. And this, as I said last week, is a huge multi-agency effort. NHS absolutely leading in this in terms of our hospitals, our community teams, our general practice teams, but also working with other partners as well in local government and in the round. So very much a collective team effort here. Put this into context in terms of the progress we're making, though, as of the latest national figures, which were published yesterday by NHS England, they show that across Northamptonshire, we have now vaccinated 56,562 people with their first dose. And that's just tremendous progress. Again, another sort of 10,000 or so step up over this point last week. The priority cohorts that we're absolutely focused on here in the first instance, the over 80s, care homes, our health and care workforce, again, we're making really good progress across the board here. In terms of the over 80s, we've now vaccinated just over 78% of the over 80s population across the county. That's about just over 25,000 of some of our most vulnerable and elderly residents that we really wanted to protect as early and as quickly as we could. That's tremendous progress. We've also, in terms of our care homes, now completed vaccinating the residents' first dose within about 2/3 of our care homes across the county, and there's significant further work this week and into the weekend by our practices, by the community nursing teams across the county, and also some of our paramedic teams. And we are now starting to see some of our sites that have made further progress, and some of the ones that went live before Christmas. They've already started now to vaccinate some of the 75 to 79-year-olds as well, as we start to move into those cohorts 3 and 4. We've already, for example, vaccinated now 40% of the 75 to 79-year-olds across the county. So you can get a sense just from those numbers, both of the scale of this endeavour, but also the speed at which we are making progress. In terms of how we're delivering the vaccination programme, we continue at the moment to do that through our 2 hospital hubs, through our 16 GP-led primary care network sites, which are distributed across the whole of the county. And we also have our mobile service, which is reaching out to care homes and to the housebound. I'm also pleased to be able to say that we are just making final preparations to open our large vaccination centre in the county, and an announcement is due to be made imminently on that. I can't, for various reasons, say anything further on today's call at this point in the afternoon, but please bear with us, because an announcement will imminently be made, and that will give us significant extra capacity into the county, all for booked appointments through the national booking system, both for staff and also for members of the public. So tremendous progress that's been made so far. A couple of kind of very topical things and questions that I'm being asked a lot, and also that our switchboard and teams across the health service are being asked a lot. The first question that's coming through an awful lot is, when will I get my vaccine? When am I going to get my vaccination? Look, we all absolutely understand that everyone within those top priority cohorts is absolutely keen, and we've seen great uptake to get their first vaccination. What I would say is to ask people to bear with us, because we will contact you, and the more people make contact into our switchboards and our other routes, it does create congestion for the people that need to get through. So please do bear with us. And we're aware that in some of our villages and towns across the county, there'll be neighbours and friends who may have already had someone in a similar age group that's been vaccinated and you've not had your call yet. We will get to you. It's just a fact of how this is rolling out and the slight differences between some of particularly the GP-led sites and where they've managed to get to so far. So that was my first kind of message. Please bear with us. We will reach out to you. The second message was around the priority workforce groups. The other message and question I'm getting a lot is for people who are keen to be included within the health and care workers workforce definition, regardless of age, which will give them quicker access to the vaccine. And I'm sure people will have seen some of the national coverage and debates that are playing out around this at the moment. Again, the key message for us locally is we are rolling out the vaccination programme in line with the Joint Committee on Vaccination and Immunisation policy nationally. If that changes, we will obviously adjust our kind of response to that. But unfortunately, approaching local providers or GP services or hospitals outside of those, again, is just going to slow down the speed at which we can roll this out to those that are currently included within those cohorts. So again, the message there is a please bear with us. We're doing everything we can to roll this out as quickly as we can. Final message for me, we are making great headway. We are confident that we have the capacity locally to be able to deliver on Boris's national pledge and commitment around the middle of February to have offered the first vaccine to all 4 of those priority cohorts. The potential rate limiting factor in that remains the supply of vaccine delivery into the county. That's not a local thing, that's a regional and national position. And we are doing everything we can. And in fact, Councillor Morris, I'll need to leave this call a bit early today to go on to a conversation with national colleagues trying to secure the vaccines we need into Northamptonshire to make sure that we can deliver on that national pledge. I'll pause there. Thank you.
Thank you very much, Toby. Some brilliant news, and as we've all said, a very important message to put across. Before, and I know you do have to leave early, Toby. So, if Toby appears to have gone off the call and there are questions for him later, we are more than happy to pass those to Toby, and I'm sure he will deal with those as and when he can. But he has an important meeting to go to if we're to keep this rollout going smoothly as it is. Before I go to the written questions, I just wanted to bring in Councillor Martin Griffiths, the leader of Wellingborough Borough Council, as he's got some reflections on our vaccination progress. And welcome back, Martin. We haven't seen you on these calls for a couple of weeks. It's good to see you, Martin.
Thank you very much, Ian. And I just wanted to say a few words and expand on what Toby has said about how well Northamptonshire is doing with the vaccination rollout. As a share of the 80 pluses who have received 1 dose, we as a county are second only to Gloucestershire with 78.2%. And our figures as far as the second dose for that cohort is leading the way in the country. There is always more to do, of course, but these are positive figures. And they're a result of hard work by all our health professionals and a great deal of planning that started many weeks ago. As you heard from Eileen earlier, our hospitals are under huge pressure, and our health professionals as well are stretched. And the message to Northamptonshire is please wait to be contacted. You will be contacted, you will be called. And there is a risk that if we inundate the NHS and our professionals with large volumes of calls, it can have an impact on performance and potentially the effectiveness of the rollout. Thank you, Ian.
Thank you very much, Martin, and I think we all agree with you on those points that you've raised there. So I'm going to open up to the questions that were submitted in advance now, if that's okay with everyone. I've got Laura Coffey first, but I do have a feeling your question was answered by Eileen earlier in her opening statement. Good afternoon, Laura. I hope you're well.
Yeah, good afternoon, Councillor Morris. Yes, I am well, thank you. It was, and so actually I had a question for Toby Sanders. Toby, I mean, you kind of touched on it there, but obviously the vaccine programme is gaining momentum in the county and across the country, and we've heard a lot about the priority groups, but what about those that aren't in the priority groups? What are the steps for vaccinating others as well?
Hi, Laura, and thank you for the question. The position on this is really, really clear that the priority groups are there for very good evidence-based reason. The priority groups have been set by the Joint Committee on Vaccination and Immunisation nationally, and they've been set, and Lucy might want to come in on this in a moment as well from a public health perspective, but they've been set on the basis of being able to maximise impact in terms of mortality. And that's first and foremost in terms of that protecting the population that are most vulnerable and most clinically at risk, and secondly, protecting our frontline health and care workers who are providing care and support to people across the county. So we think that locally that the cohorts are there for absolutely good sound reason, and that's why we and all of our teams are working within that guidance position. Clearly, the further through we go over the coming weeks and months, we look forward to the point when we can really roll this out across the lower cohorts as we start to work through those, and we all know that's where we get some much bigger numbers in terms of the population coming through as well. But it's the point, and I think the reason as well why Eileen's message earlier on is so key here, that until we get to the point where we've got much larger numbers of the population that have had their first and then in time their second vaccination, we really need to carry on doing everything that we are in terms of the rules and in terms of the guidance at the moment. I hope that helps, Laura.
Thank you, Toby. Thank you for your question, Laura. Lucy, did you want to comment on that question at this point? No, thank you. I think Toby did an amazing job of answering that as always. And of course, nationally, we're doing extremely well on the numbers. It's got to be remembered as well. I know locally we're doing really well, but I think it was, what, 4 million or something like that yesterday. And that's pretty impressive if you compare, never mind our county, which is doing very well, but if you compare us as a country to other countries, we are doing extremely well. So we are getting there, but all those messages that Toby just put in his answer are still very relevant. So I'm going to move on. Thank you, Laura. Thank you, Toby. And I'll come to Neil Barber. Hi, Neil.
Hi, Councillor Morris. One for Lucy on lateral flow testing and one for Toby on care home vaccination, if that's okay. Lucy, we know you're rolling out the lateral flow testing in the community. Luton Borough Council unveiled a similar scheme on the 10th of December, and since then they've identified around 1,700 asymptomatic cases. Why wasn't the community scheme in Northamptonshire rolled out sooner? And to Toby, care homes that we're speaking to in the county are worried that when the vaccination team come in to the care home, they are getting the odd case that can't be vaccinated on the day, but they're not being presented with a plan to come back and vaccinate. What happens in those cases where you're not able to do it as you're in?
Thank you for the question. So I'll go to Lucy first, then Toby, although we do have Katie Brown on as well from Adult Social Care, so it might be a combination answer there. But I'll go to Lucy first for your first bit, and then Toby and possibly Katie on the second question. Thanks, Lucy.
Okay, thanks, and thanks for the question. So a couple of reasons. At the point at which the government decided that lateral flow testing should be one of the options, obviously there was a number of pilot schemes, which I'm sure you're aware, started in Liverpool, and then there were a couple of other areas that were included, different levels of local authorities. At that point, they were obviously still looking at the evidence about how much value it adds, because as we know, sensitivity for lateral flow is much lower than it is for PCR testing. So you obviously have to balance off the risk of having a number of false negatives, and therefore people who are infectious still going about their daily business. Lateral flow testing therefore only really adds a lot of value in areas where you've got really high positivity rates. And at the point pre-Christmas, if you remember, we were in a reasonably stable place as compared to other areas. We were still in tier 2 as compared to other areas surrounding us that were tier 3 and tier 4. Indeed, Luton was tier 4, I think at that point that you might have even mentioned, if not definitely tier 3. So at that point in time, we weren't considered to be a priority area. When things started to look like they were changing and the government made a decision that actually they did feel this added value and that they wanted it used more widely, all of the directors of public health were asked to pull together plans and obviously submit them. We did so before Christmas, but we only received our first delivery of lateral flow devices, and that was a very small number on Christmas Eve. So obviously to be able to roll it out at a community level, we needed a much more robust plan, but also a much bigger delivery of tests. So as Elliot's already alluded to, we've worked with organisations that are frontline and at high risk. So we've already got some distribution centres where outbreaks have already been noted using lateral flow device testing, and organisations such as the police, already doing it with the small supply that we had up until more recently. We got that much larger delivery last week, and from now on we are being told that we should be able to maintain a much higher proportion of tests being delivered to us, and therefore we've got more scope to get them out into the community. So a number of factors that play in there, but obviously it's important that we've got them now and that they're obviously being targeted at those high risk staff groups.
Thank you, Lucy. Toby, did you want to come in on the care homes? And then I will go to Katie Brown as well, as she's the Director of Adult Social Care, because she may have some comments as well. Toby.
Sure, thank you. Yeah, good question. So I'm guessing you'll be referring to people that when we're coming out to care homes, we've got some residents who either in terms of their health on that particular day or in terms of other conditions might not be in a position to be able to receive their first vaccination. At the moment, our first priority is to get round to all of our care homes that are eligible as rapidly as we can with the roving team to be able to reach out to as many people as possible. I mentioned that we've already done about 2/3 of care homes. By the end of this weekend, we will have got through another significant chunk of that remaining third or so. That means that once we get into next week, that our mobile service and also the home visiting service will be able to then start picking up on individual residents within homes, as well as housebound patients on an individual basis, to make sure that we can reach out to those people who've not been able to be captured through that first initial visit. The other group of people that we're vaccinating at the moment through the roving model into care homes are also care home staff who might happen to be on shift or on duty when we come out and visit the particular home. But for all of those care home staff who aren't in on that particular visit occasion, they are also then be given the opportunity, because they're more mobile and able to attend at the moment one of the hospital hub sites at Kettering or Northampton. And with a fair wind, once we've got through the announcement I referenced earlier on the vaccination centre, they'll be able to access their vaccinations as a worker and member of staff through the vaccination centre route as well. I don't know if Katie might want to add to that perhaps. And Ian, apologies, I'm going to have to drop off the call at this point, but if anyone does have any further questions, Lucy may be able to answer them. If she isn't, more than happy to follow up afterwards.
Exactly. I was going to say that. Thank you, Toby, so much for coming. I know your time is very, very valuable at the moment. So thank you for your attendance. Katie, did you want to add anything to that answer? Because I think the care home cells and the work they're doing is important to sort of highlight as well. Thank you, Katie.
Yes, just to confirm what Toby has said, we have a plan post the first phase of making sure that all care homes are vaccinated. We've also put in place a plan for people that will be admitted to care homes in the future that may not have been vaccinated through the routes that have already been in place so far, and also for the, people that will end up in short-term rehab, for example. So that plan's already in place, but our first priority is to make sure that every care home has that first visit from the roving team to do the majority of residents and those that they can do on the day. And obviously, just to say, the social care mass vaccination programme, care home staff have been being vaccinated since mid-December, and for the wider social care workforce, that starts from Monday, and we have now providers that are booking in their staff en masse from next week, and it's been a real team effort across the system to make sure that the health and social care workforce collectively, those that we need to protect so they can continue to support vulnerable people, are protected in the way that they need to be, so that we can start to move forward and ensure that we still keep everyone safe in Northamptonshire.
Thank you, Katie, and thank you for that question, Neil. And thanks go to all the teams, Katie, that you represent in adult social care, as we said earlier, for the amazing work they've been doing under a lot of pressure as well, to keep our residents as safe as possible in the homes and other care situations. So thank you for that. Neil, thank you for those questions. I'm going to come now to Tom Hitchener. Tom, are you there?
Yes, I am. Good afternoon. Thank you for the update, everyone. So I think firstly, from this be focused towards Eileen, Kettering General Hospital said in a recent statement it could be possible that patients could be moved off-site for treatment given the scale of the COVID need. Could you possibly update us a bit on how close this is from happening and how would that work? My second sort of question would be, some experts believe that lockdown isn't working, but do you agree with this from a Northampton perspective, given that you said the decreases in COVID rates we see across the county? And I think finally, this is for Elliot. Could you possibly give us a bit more information about enforcement patrols in country parks and maybe groups meeting up there or things like that? That'd be great to learn a bit more about that. But those are the three I have, so thank you very much.
Thank you, Tom. Some good questions there. We'll do them in the order that you asked them. So we'll go to Eileen first on the hospital question. Eileen.
Thank you. Thanks, Tom. So we did put out some statements at the weekend, and one of the reasons for saying it may be possible in, it may be needed in the future that we would actually look at the distribution of services between ourselves and KGH and NGH was really around paediatrics. And if the numbers stay the same, and let's hope they do, and they come down and they don't go back up again, which is all to do with the behaviours we've been talking about today, then we will be fine. But in certainly running acute hospitals at the moment, you would never say never, because if anything else happened, or we had another wave, or everything didn't go to plan and we haven't got the numbers right, then it could be that we would have to, in order to preserve and keep services going, for example, like paediatrics, because that's what I was referring to at the time, we might have to say, well, we've got a paediatric service that's got a smaller number of inpatients, as has Northampton General. We've got a big paediatric ward. Why don't we, for the moment, have inpatient children together? So that's not likely now, because the numbers are coming down. And as a number of my colleagues have alluded to, we've worked really, really hard as a system to make sure that as patients are admitted to hospital, they either go home or they go on to continuing care elsewhere at the moment they're ready to do so. And we've been able to keep that up, and that's with lots of input from our community trust colleagues and social services and our colleagues there, which we've mentioned a lot today. So we're keeping people moving as through and home as soon as they are ready, and that will prevent us, along with numbers that are stabilising and dropping, to not have to make any more dramatic moves. So we are not near to it. But if you'd have asked me that question this time at the beginning of last week, the numbers looked very, very different. And we are busy now, but we were expecting to be a whole lot busier. Now, fortunately, lockdown is starting to take effect, as we've talked about today. But, if what we have seen is a dramatic increase because of the one day over Christmas we were allowed to socialise, imagine what it would be if actually everybody just said, well, okay, all bets are off and let's get back to normal. So we have to be really, really careful. So in answer to your question, we are not near it. I would never say never, but there are no plans currently. But that is all to do with keeping the demand down.
Thank you so much, Eileen, for that answer and for the question as well, Tom. So the second part of your question was probably to Lucy and Jonathan Nunn. So if we go to Lucy first and then Jonathan Nunn, that would be great. Thank you, Lucy.
You have to remind me what the question was. Apologies, I've had to answer a call and a question instead.
The question was about some experts have said lockdown isn't working. Do you agree with this from a Northampton perspective, as our rates appear to be coming down? So that was the question. Do you want me to go to Jonathan first and then come back to you?
I'm quite happy. Apologies.
Don't worry.
Clearly not doing very well multitasking. So lockdown, well, I think it was clear that I was concerned previously, and we've talked about the fact that this is a much more relaxed, for want of a different word, lockdown as compared to the ones we've seen previously. Is it working? Yes. We've thankfully seen that in the data this week. But, do we need to keep doing more? Absolutely. As Eileen also mentioned, we cannot afford to be complacent. We're still very much feeling the pressure in a number of our services. And should people think that this is, carte blanche to start doing what they please, we will, sure as eggs, bounce back up. And because of the infectivity level of this strain, we will bounce back, and we will bounce back high and hard. So we have got to be extraordinarily careful and continue to adhere to the rules for some time yet. But I think the most important thing to note is it is working. And so please, it's about doing more of what you're doing. And for those that aren't doing it yet, to damn well join in, because it's only by standing together on this that we're going to get out the other side. So yes, it's working, but we've got to keep doing more.
Thank you, Lucy. Couldn't agree more. Jonathan, hello, Jonathan. Did you want to comment on the question?
Well, happy to. Perhaps even since the question was submitted in the figures and the trends that Lucy's shown us earlier have illustrated that it is working. I think it's not a silver bullet, is it? It's not as easy as just saying, well, surely fewer people are mixing, it must go down. And Eileen's point about what happened over Christmas, we all mixed just for that one day, perhaps a little bit more, and look at the impact it has. You would think that with the reduction in the amount of mixing that's going on, because most people are being incredibly careful and vigilant, you would think with the huge reduction in the amount of mixing, the reduction in that mixing, that you would see a bigger decline. But this virus is just so determined, and perhaps particularly with the new strains, it sees a slightest crack and it gets through there, doesn't it? Quite frankly, if every single one of us did not mix with any other soul for a period of time, perhaps we'd get somewhere, but we're not practically able to do that. And I do agree that this is a slightly more relaxed type of lockdown to what we saw in the first lockdown. But there is a difference. Do you remember the first lockdown in April and May? We all diligently did what we were being asked to do, but we did that on blind faith, because actually very few of us actually knew anybody who had contracted the virus. I have to say, I know a significant number of people now who have either currently got it or have recently had it. And that's quite different. So I do see a dilemma in the fact that this lockdown is slightly more relaxed, yet I personally, and most of my friends are the same, know far more people who have got it. So that complacency, just because we've learned to live with this a little easier, is our real enemy. I think we've got to stick at it. Thank goodness the vaccine is going so well, and thank goodness, as Martin points out, in Northampton we're really a beacon for getting that rollout done. So big congratulations and thanks for all the people who are doing that. The lockdown is working. It's just not an easy silver bullet solution, in my view. Thanks, Ian.
Thank you, Jonathan. And now over to Elliot for the question around country park patrols and enforcement. Elliot.
Yeah, thank you, Tom. Yeah, we put extra patrols on, as I said we would last week. We did see an increase in footfall around some of the country parks. One of the things we did, for those of you who did venture out and decide to go despite the advice, you will have found police officers and staff, PCSOs patrolling. You will have seen parking measures where people had been illegally parking on verges or parking in a dangerous place, because we wanted to prevent that build-up. But I will tell you, we did issue fixed penalty notices to people out and about, 9 of them in country parks last weekend, and they were all 9 of them were for families mixing. This is the one thing we've been saying, isn't it? This is where the virus is spreading, and people continue to do it. And so we've got more people out this weekend. I know that the weather has been bad over the past few days, but if we get a dry spell over the weekend and you decide to head out again, don't mix, because we are there. We will be speaking to you, and if you have got mixing of households, you will be getting a fine.
Thank you, Elliot, as always. Very direct answer, but a very good answer. Thank you. That's what we have to do. We all have to obey the rules. We are getting quite short of time, but we will crack on with the next question, which is from the Chronicle and Echo. And I believe Kevin or Jack or Alistair are on the line. Is it Kevin? Hello, Kevin.
I am here. Ian, but could you ask Jack's question, please, if you don't mind, because that one's far more important to address than mine. Jackie's on the call. He'll chirp up in a minute.
Oh, okay.
Yeah.
Jack, are you there?
Yeah, I'm here too.
Do you want to post your question then, Jack? Thank you.
Yeah, it's just about, we've had a lot of reports of outbreaks in workplaces, as you obviously saw in the data as well. A lot of people seem to be saying that they're worried about reporting symptoms or being positive tests because they're worried about having to self-isolate and not being able to afford it. Sort of grants, things like that, but also being maybe encouraged by their employers to come in because of the staffing issues. What would you maybe say to people to reassure people that there is support available, what support is available, and is there anything done to help those sort of lower paid people to ensure they do self-isolate?
Thank you, Jack, very much. I think that's probably one for Elliot and Tom. So I think we'll start with Tom, if that's okay. Tom Beattie, who's the leader of the Corby Borough Council. Tom.
Yeah, thank you, Ian, and thank you, Jack. That is worrying. I mean, that one of the things that I've been very careful to do over the last week or so is not accuse anyone directly about not abiding by the rules and regulations. I did express a concern about whether those rules and regulations were, were sufficient for the type of work that was going on in Corby. But I mean, if we're hearing stories about workers being encouraged or being discouraged to, not take tests or reporting symptoms or even positive tests, and that worries me. I mean, the question that I have in front of me goes on to ask, is there a process for reporting that anonymously or otherwise, similar to the process that exists for the police for reporting other COVID breaches? I would encourage people to contact us at the council if that's the case, and they can do that anonymously. I give that commitment that we would not identify any worker in any industrial setting in Corby who is feeling under pressure not to do what is safe. We're very keen to ensure that employers do what is safe, keep their workers safe, follow the appropriate restrictions. So please, if anyone does feel under pressure not to do that, then contact us. They can email us at the council, they can phone us directly, can speak to our environmental health officers. We'll help investigate that and ensure that workers aren't being put in that sort of invidious position. The position around workers not being able to afford to take time off, again, that is an issue that I have raised with government. It's a concern that people who are working in low-paid areas or people who don't have the ability to work from home should be supported. The employers that they work for should be supported. If it's felt that the work they're doing, if it's the manufacturing or distribution centre, isn't essential, I've made that clear, and I continue to make that clear that that's a concern. And there are a range of grants and support available for people, both employers and individual employees, to access. So I hope they would do that. I mean, we have talked here today about the difference between this lockdown and the previous lockdown, where a lot more people were furloughed and were able to stay at home. It's different this time, and we have made that case, and we continue to make that case. But there is support there for employers and individuals, and a range of grants that are available to try and help people get through this pandemic. Thank you.
Thank you very much, Tom. Elliot, I'm sure you have something to say on this as well. Elliot.
Yeah, I'll just add, I mean, we work hand in glove with the Environmental Health Agency, with districts and boroughs, local authorities. We are really working closely through our joint enforcement team. If you have a concern about this, then you can contact the police as well. You can contact us either anonymously online, or you can call us. All of that information comes together and we paint a picture through our joint enforcement team. We work together to tackle it. So if there's an employer that has got these kind of practices going on, and they're probably few and far between, but if they are going on, report it. We will deal with it with our powers, with the environmental health powers, with health and safety exec, and we will tackle it.
Thank you very much, Elliot. I think Kevin, Jack and Alistair, that more or less has covered most of your questions there, if that's okay. So I wanted to just move on, if I can, to the Global Media Group questions, which I will read out because they don't speak at these meetings. So there was 3 of those. There was the first one, which was to Elliot. We've sort of covered it, but I think they would like us to repeat it, so we will, and it's always good to repeat these messages anyway. Do you welcome the increase in fines announced by the Home Secretary to combat mass gatherings? Elliot.
Yeah, as I said at the start, we welcome any measures really which can help us support our public health colleagues, because that's exactly what this is about. Where we see breaches, where we see large gatherings, they clearly pose a health risk, and giving us the power to prevent that, and that deterrent that acts as, £800 is quite a hefty fine if you're going out for a party and it's going to cost you £800. So yes, we welcome it. We'll wait to see the exact details of how we'll enforce it, but you can guarantee we will be using it.
Thanks, Elliot. We all welcome that news. I think the more power, the more sort of enforcement powers you have, and the financial implications for breaking them, the better, in my opinion. There was one more question for you, Elliot, which is there any evidence people are breaking rules to share vehicles to get the jab? Elliot.
Oh, I mean, the one thing we want to say about this is, you know what, we really want people to have the vaccine. We want you to go get the vaccine. So if that means you're driving to get the vaccine, great. If possible, share a car with someone from your own household. If you have to, if you can't drive yourself, stay within that bubble. Reduce that risk of mixing, which I spoke about earlier on. However, you can leave the house and be with somebody else for medical reasons, and this would be a medical reason. And we would just say that if you're going to do that, I think any of the health experts on the call would agree with me. Wear a face covering, wear a mask, take precautions, and go. But the main thing is, please, people, if you get this through, go. It's really important.
Thank you, Elliot. There was one more, which is probably for you, Lucy and Eileen. Reports from the US suggest there's been a 98% fall in cases of the flu. What's the evidence here? And if it's a similar drop, why are you still asking people to have their flu jab? Shouldn't medical resources and personnel be kept to COVID response and people away from medical centres only for the most serious reasons? So I'll go to Lucy first, then Eileen, if I may. Lucy.
Okay, thank you. Thank you for the question. So I'll be honest, I haven't seen any data about the actual prevalence of flu this year. We do know it is lower, but Eileen will add some detail about the fact that it is still around. And I think the other thing is you shouldn't underestimate flu. It's actually one of the biggest killers, usually during the winter. So for those people that are vulnerable, this is just as serious as COVID is. It's a different type of virus, and therefore, people should not think that by getting one vaccine, they don't need the other. If you're eligible, you'd need both. And we've been encouraging people to get the flu vaccine for some time during these press conferences, and we'll continue to do so because, as I said, people who are vulnerable to flu remain vulnerable to flu. We know that things are still being transmitted because we're still seeing COVID on the rise. So, flu is still out and about. People must get their flu vaccination if they're offered it. The other point about allocation of resources, if we couldn't afford the staff to do both, we wouldn't be. We would look at a form of prioritisation. As it is, we are managing to be able to provide both, and therefore people, if they're offered, should be taking up both.
Very, very precise answer. Thank you, Lucy. I've had my flu jab, as I'm sure lots of people have now on this call, and I will be marching to the vaccination centre for my COVID jab as soon as I'm allowed to have one. Eileen, did you want to comment on the flu bit of that question?
Thank you. Yes, thanks, Councillor Morris. So just to say, we often talk about winter pressures in hospital, and we've got COVID going on and winter pressures. So flu is out there, as Lucy has said. And I think you will have heard the scientists and the experts saying, get both of your vaccinations as soon as you're offered, because if you get flu and COVID together, you are in a very difficult position and people do not do well. It is still out there. Why wouldn't you have it? We're so fortunate in this country, actually, to be offered all of these things. We must take them up because it's been a colossal effort by GPs, volunteers, our colleagues in the ambulance and police service and the NHS to get everybody vaccinated with what it is they need. So take the opportunity, because you do not want flu and COVID. You really don't. It will not. It doesn't always end well. So take what's there.
Thank you, Eileen. A very, very sobering thought on that front as well. Just there's years of evidence for the flu jab anyway, and certainly the efficacy of the vaccine currently is pretty well trodden path and very, very safe as far as we know. So I've got probably time for one more quick question, which is in the chat group from Sarah Ward. I know Sarah's asked a couple of questions, but I'm only going to ask one bit of it because we are literally running out of time. So what information are you gathering on the numbers of people in the county refusing to have the vaccine? Are vaccination refusals a concern? I mean, it sort of leads back to what you've already answered, really, but it gives you both a chance to reiterate that. So I'll do it in reverse order. Eileen, I'll start with you and then go to Lucy. Eileen.
Thank you. So I don't have the exact data, but we do have, it isn't just refusals, it's a sort of reticence to have the vaccination at all. And when we see it in the hospitals, so we're lucky in health because we are in the kind of priority groups. But there are all sorts of myths, going around, I've heard just this week something around affecting your fertility, to does it contain meat products, to it's got alcohol in it, to all sorts of things. And we work really hard on a daily basis in the hospital, not least because we want to protect our staff, their families, our patients, everybody, to say, have the vaccine. Everybody has a right to refuse, of course they do. But it's not just about, and if I wanted to refuse, it isn't just about my personal safety, it's about the personal safety of my loved ones and the people I come into contact with. So we do know that it's an issue, and it is a big concern, particularly if you are a frontline healthcare worker. We are encouraging, because maybe it's out of fear or maybe it's out of all sorts of things. We're trying to dispel myths and just encourage people to have the vaccine, but we are conscious There are a group of people for whom that, you know, either it doesn't exist or it's a hoax, or you know, I'm not having it because it will be bad for me. Actually, getting COVID and not surviving it is bad for you. So you know, the messages just remain the same. Be sensible and take what's offered.
Thank you very much, Lucy. I'm sure you can add something to that, but I thought that was a very powerful message there. Thank you, Eileen.
I don't think there's much to add there. Just so we're clear, that there has been no national data released on this, or local data. Although I understand from, you know, off the record kind of reports, it is still a relatively low proportion who are refusing. Thankfully, most people do understand what benefit this adds. They do understand it protects them and others, and they do understand that by doing, you know, the uptake of the vaccine alongside all the other measures that we've continually reinforced, these are the steps that we need to take to get back to a sense of normality. So I don't think there's much I can add to Eileen's.
No, thank you. I mean, there is so much misinformation on the internet generally anyway, never mind about vaccination. I would advise everyone to take a massive pinch of salt with anything they read on the internet, unless it is very well sourced or very well signposted from good sources, and very rarely the case. So I think that is probably, I know Sarah did ask a couple more questions. What I would ask is if she wouldn't mind directing them to us outside this meeting, then we will answer those as we can. We've just literally run out of time, so we're already 7 minutes over, so apologies, Sarah, but we'll try and give you some time next week. But between now and next week, if you submit those, we will make sure they're answered for you. So on that note, I would like to close the meeting. I'd say thank you very much, as always, for all the attendees, all the questions, and all the answers as well. It's they really are very informative sessions, and I think everyone really values them. So thank you very much. Stay safe, stay well. Let's follow that guidance, and together we can beat this virus. Have a good weekend.
Thank you, Councillor Morris.
Thank you.